based on the evolving epidemiology of COVID-19 and the potential decrease in protection from vaccines over time. So in line with these recommendations, Newfoundland and Labrador will begin offering a first booster dose of the COVID-19 vaccine to those aged 12 to 17, starting April 25th. And individuals in this age group will be eligible for a booster when 22 weeks has passed since their second dose of vaccine. We will also be offering a second booster dose to those aged 70 and older, those in a congregate living setting for seniors, such as long-term care, personal care home, community care home, or assisted living facility, and anyone aged 18 and older who identify as Indigenous or live in a remote or isolated Indigenous community. Individuals in these groups may have an increased risk of severe disease from COVID-19 infection, and they will be eligible for a second booster dose when at least 20 weeks have passed since their, since their first booster dose. So for example, if you received your first booster dose on December 23rd, then you're going to be eligible for your second booster dose on May 5th. Regional health authorities will begin offering second boosters to those living in congregate living facilities in the very near future. When these are substantially completed, appointment-based clinics will open. Individuals will be able to book appointments online or by telephone starting April 25th. We anticipate that the majority of people will become eligible for second booster doses in May or June. We also encourage individuals to avail of their booster dose through a pharmacy or family physician starting April 25th. To assist in the uptake of vaccines at pharmacies, we will be providing pharmacists with the Pfizer-BioNTech vaccine, as they were previously limited to only Moderna vaccine due to storage requirements. And I want to send a big thanks out to all participating pharmacists and physicians that have helped administer vaccines across the province. You have and continue to play a critical role in our vaccination rollout. As many have learned by experience, COVID-19 vaccines may not prevent a COVID-19 infection. However, they will help reduce the severity of illness in the vast majority of individuals. While unvaccinated individuals comprise 32% of COVID-related hospitalizations and 28% of COVID-related deaths, they only comprise 7.8% of our eligible population. This is a testament to the power of vaccines. Vaccine effectiveness can diminish over time, which is why it is so important to get your recommended booster dose, particularly if you are age 70 or older. Even if you have had a COVID-19 infection, everyone should ensure that they are up to date with their COVID-19 vaccinations. This includes your primary series and all recommended boosters. When public health measures were lifted last month, we committed to revisiting masking in schools following the Easter break. Based on the epidemiology here and across Canada, and after discussion with the Department of Education and school districts, Public Health has recommended that masking continue to be required in schools when school resumes after the break. We anticipate this recommendation will remain in place for another month. I am very encouraged that the majority of people continue to wear their masks in public spaces. Masking will continue to be strongly recommended until we start to see more favorable epidemiology later this spring. It is a simple way to protect ourselves and those around us. In discussions with our science table, we feel that we are near the peak of the wave. And while the peak may be more extended than ones we have seen previously, we do anticipate epidemiology will start to improve in the weeks ahead. So I'll now take questions from the media.
Any indication if people younger than age 5 will be able to get vaccinated at any point?
So those studies are ongoing, and I'm sure the vaccine companies are working through that, but we don't have any information about when those things may be available at this time. No.
With more fourth doses now, I guess, being administered, will, I guess, more staff have to be diverted from, to do this, and will that cause an issue for the healthcare system right now? So,
certainly that's something that we have to consider when it comes to delivering fourth doses, and the regional health authorities are working through those working through those plans at the moment. But, we are trying to get healthcare back up to where it was before, and we certainly want to make sure that, people are able to get their necessary appointments and things like that. So it is something that the health authorities are going to have to work through, but they are certainly looking at those plans right now.
Do you see any of the clinics that were closed reopening due to this fourth dose?
The vaccination clinics, you mean, the mass vaccination clinics? I think that's certainly part of the consideration that the regional health authorities will have to make. And again, that's going to take a little bit of time and a little bit of planning. And so we certainly, I certainly don't want to presume to speak for them, but I would not be surprised if that happened.
You mentioned that 12 to 17-year-olds can now get their booster, but what about 5 to 12-year-olds?
Yes, so there's no booster recommendation from the National Advisory Committee on Immunizations at this point for that age group. And some of those studies are still ongoing. So, the vaccine companies are looking at that as well as, I'm sure, other groups. But at this point, it's mainly for the 12 to 17.
Do we know how many healthcare workers are currently in isolation now?
The last I heard, it was around 400, but that may need to be confirmed.
Do you know what percentage of the population has contracted COVID at this point?
Percentage-wise, I think, we're up to somewhere around 37 to 40,000 infections that that are confirmed infections that we know about. And we certainly know that it's probably 4 to 6 times that amount of people who have actually tested positive. So, that's upwards of probably 160 to 200,000 people.
There's one estimate of something like 46% of the population is tested positive. Do you think that is fair?
So I guess, I don't know if 200 would be quite 46, but it's, it's getting up there for sure. Yeah, I think some seroprevalence studies have shown that that's, between 30-40% is around where we're seeing it in some other areas. And so, I wouldn't be surprised that we're getting up to that point. But
we hear a lot of questions about long COVID. What are your thoughts on long COVID? Is it something we're going to have to deal with in the future?
It's something certainly that we are going to have to look at. There's no doubt about that. I mean, I think for some people who get COVID, it's more than just a respiratory illness, and it can affect other parts of the body. So we certainly are going to have to look at how we deal with long COVID. When you're getting into dealing with that individual person, it's getting a little bit out of public health scope. But it is something that I think we're going to, we'll have to develop a way forward about.
Just a little clarity on the masks in schools. When you say it's going to be for another month, that's as of, I guess, the end of the March break. So where does that take us?
Oh, so a month from, so we were going to revisit it this week. So it's a month from now, basically, is what we're talking. So around the 13th, I think, of May is about 4 weeks from now.
Are hospitalization still your key metric? And given that they're down below 40 now, are you expecting, because that danger area of 40 to 60 that we had previously discussed might be enough to consider restrictions, but do you think we're out of that for this period now, or do you think people can expect to see probably inch back and then come back?
Yeah, so I think hospitalizations are going to go up and down a little bit over the next little while. We certainly, hospitals lag behind cases. So if we're thinking we're at our peak with our cases, then hospitalizations are going to lag a little bit. So I think we'll see it go up and down. But things are looking favorable that we should start seeing a downward slope in the near future.
And regarding the rest of Canada, the talk, the second wave, Ontario especially, makes much of that. Where are we in that realm? Are we lagging behind them? Can we expect to sort of stabilize? Can we expect something else, another kick from that? Or are we ahead or behind?
I think we're a little bit ahead, actually. We opened up probably a little more, and so we've been seeing a fairly steady but Well, it's a fairly steady climb over the last 3 to 4 weeks, really, and so, but that climb has been very controlled. So it's never gotten to a point where we're doubling in a an unreasonable amount of time, and so I think we are probably seeing what Ontario is starting to see, but slightly different. So our curves are going to look a little bit different. I think it's not going to look quite the same, but I think part of the reason why we want to hang on to masks for another little while is that we want to make sure we're well and good on that downslope before we lift, we stop recommending those measures.
Will boosters sort of become an annual thing going forward?
That's it's a difficult question to answer at this point. I mean, certainly what we have seen to date is that the immunity that comes from boosters is it can wane the further out you get from your dose. It can also wane the further out you get from infection, right? So that's pretty normal. That happens with a lot of different things. And certainly, part of the reason that we manage to, we get other coronaviruses, for example, that cause colds. You get them year after year, and then eventually you build up your immunity, and then you go for years and never have one until you have kids, and then, then you're exposed to it again and you get colds again, and then you build up your immunity again. So those sorts of things, we're still really new with COVID, right? So as things start to develop, and as we start to live with it more, and as we start to, we may very well see a seasonal cycle with COVID, but I don't know that anyone knows for sure exactly what's going to happen at this point. So we'll see what the fall brings. We're almost certainly going to see, another surge, another bout of COVID circulating in the fall, and then we have to be concerned about flu as well. So we're going to see, both of those things probably circulating at the same time.
With that in mind, is it possible that restrictions could increase again in the fall?
I mean, that's certainly not our goal at this point. Our goal is to try to manage things in the least restrictive way possible. And so, that's why vaccinations and being up to date with your vaccinations. So not just your primary series, but also whatever boosters are recommended. That's really important. And just, hopefully by the time the fall comes, we'll all have those measures strongly entrenched, that we keep our contacts low and we try to reduce our own risk for spread of the disease. So we'll see what the fall brings. Certainly we're planning, we're making all kinds of contingency plans. So we're planning for something that circulates like Omicron. We're also planning for something that's a worst case scenario. So that's what we have to do, because we need to be ready for every eventuality, I guess.
What would be a worst case scenario? Like, what's the worst case scenario?
See, I knew I shouldn't have said that. I don't want to go down this road because it's, that scares people. But, certainly we have to be cautious. COVID has tricked us before many times. So tricked us, kept us on our toes, I suppose. And we do have to watch out for a variant that may be more transmissible than what we're seeing right now, than the Omicron. And of course, the thing that we're obviously going to be really watching for and are concerned about would be if we had a variant that was significantly able to evade vaccines, right? And so that vaccines wouldn't be as protective. So those are things that we're watching for very carefully. We don't see that at the moment. I need to make that very clear. But those are kind of the things that you have to consider when you're planning for something like this.
On the fourth dose, is there any departure at all from the NACI recommendations in this province?
Not really. No, we've tried to stick with as we have all along. We've tried to stick with NACI. Certainly, they've steered us straight up to this point, and their recommendations are certainly looking at the best evidence that's available. So it's essentially so NACI made some strong recommendations and some discretionary recommendations, and we've taken all of their recommendations into account. Yeah.
Any recommendations for families, I guess, gathering over the Easter weekend for larger gatherings?
Well, as we've always said, just make sure you keep your contacts low. Make sure you wash your hands well. Get outside if you can. That's That's really helpful for reducing your risk. And, if you're sick, stay home. Don't just, for a lot of people, they think COVID is a cold. But COVID is a cold for a lot of people for a number of reasons. Yes, it's a milder variant, we feel, but at the same time, most of our population is vaccinated, and so the vaccines are doing their job. And so part of the reason why this is a mild illness for most people is because they have their vaccines. So you need to, there may be people in your group that may not have as good an immune system, so you need to be careful about that. And if you are feeling sick, you really should stay home. And even if you have minor symptoms, you really should stay home and not be socializing with people at this point. Just try to keep all those things in mind as you go out and try to spend some time with your friends and family.
Is there an opinion, scientific or otherwise, on what's the more riskiest, or what would be the preferred? Like if we had to, say, live with Omicron going forward, and there were no other variants, and I know that's hypothetical, but versus a Delta. So you have the more transmissible but less severe versus more severe but less transmissible. Has there any been, a scientific opinion on which would be healthier?
So I think, obviously, there's a couple of things that you have to think about in that situation. So one is how does it affect your health system capacity, for example? And certainly a virus that's more transmissible, just by even if it's milder, by sheer numbers, can still potentially overwhelm your health system, right? Which is what we saw with Omicron, milder variant, more cases, you can overwhelm. So you have to be careful of that, as opposed to one that's a little less transmissible. You may not see as many people. So even if it's causing more severe disease, you may not see the same level of capacity concern in the hospitals because of that lower number of people who actually have the disease. So, and obviously from an individual point of view, it's always better to have a disease that's less severe. But we think about things in public health. We think about things on a population level.
Will there be any plans at all to increase, availability of rapid tests that are available for free as opposed to people having to buy them?
So at the moment, we're dispensing our rapid tests where we feel like we need to use them the most. And, we're trying to keep kids in school, and also looking at those places where people may be at higher risk of severe disease or higher risk of spread, so congregate living facilities. So staff in those areas, for example, are doing asymptomatic testing. But in general, we're looking at, of course, as I said, we're looking at and planning for what might happen in the fall. And part of that is looking at rapid testing and where that fits in. But as we've always said with testing, we want to make sure that we're using it in the most efficient and best way possible that's giving us the information that we need and allowing us to control the spread in the best way possible.
Just as a sort of recap, can you I know you said this, but could you say who will be eligible for a fourth dose first and when they'll be able to get it?
Yeah, so eligibility for fourth dose, so that's your second booster. Let me get my notes so I make sure I get it right. So it'll be anyone age 70 and older, and those who live in congregate living settings for seniors, so that would include long-term care, personal care homes, community care homes, and assisted living facilities. And then anyone 18 or older who identifies Indigenous or live in an Indigenous or isolated Indigenous community. And they can get it at 20 weeks after their first booster. And, the RHAs are going to be focusing first and foremost on trying to get to those long-term care and personal care home facilities, those congregate living facilities. And then after the 25th is when people can book appointments for in the community, and pharmacists and physicians, of course, after the 25th as well. So.
Nancy said 6 months, didn't it?
So what Nancy said for that statement was 6 months, but they also said with the caveat of, depending on your epidemiology and but they really did encourage to work to get those vulnerable settings vaccinated as quickly as possible.
I'm sorry, just to clarify, and I know this is probably covered, I was writing when you first came in, so I might have missed the top, but will the fourth, there's people who have angst over the fourth dose being mandated. Is the fourth dose going to be eventually something we all have to get?
So, I mean, those questions and those policies are not necessarily just mine to make. And, you know, so what we are recommending at this point is that everybody be up to date with their COVID-19 vaccine. So that includes your primary series as well as any boosters that you're recommended to have. So if you're 12 to 17, the booster is, your first booster is recommended, and then if you're over 70, then your second booster is recommended. So we're really, I mean, our strong recommendation is that you be vaccinated such that you're up to date. With regard to mandates, the first booster was not mandated, so I certainly can't speak to what policies may develop as time goes on, but we're not having discussions at this point.
Yeah, I was just thinking public sector workers, people who do have, mandated place that they had to get vaccinated in order to be able to work.
Yeah, so there's a mandate in place for them to be considered fully vaccinated, which is your primary series, but there's no mandate for boosters at this point.
Any more questions?
Thank you very much.
Thanks.
Thank you.
Good job, Rich.